So the last little bit I've been dealing with an ear infection, and our healthcare system is horrible. So we have a saltwater pool and it has a chlorine generator. Now that chlorine generator broke and our pool started to go green. And it was during the hottest time a few weeks ago. So I decided I was gonna go swimming anyway, which was a mistake. Growing up as a kid, I dealt with ear infections. I had a bunch. It wasn't a chronic thing, but I did have a bunch. I haven't had any since I was a kid until recently when I decided to take that little dip. And as a kid, my parents would take me in to see the doctor. We'd get an appointment, go in, usually a few hours after they called, and I'd get prescribed probably, I think it was amoxicillin or something like that, and that would clear up the ear infection, usually right away. Now it's been a while since I've been a kid, and times have changed. So normally what would happen is I would, call the doctor, get an appointment, go in, he'd get me a prescription, I'd go pick that up, and everything would be hunky-dory. However, about 2 years ago, a year and a half ago, our family doctor retired, and we're now on a waiting list for a new doctor. One of the benefits to not having a personal doctor, though, is they can't book you in for for us older guys. It seems to be a problem throughout Canada. People waiting on doctors, they don't have access to primary caregivers. The recent statistic was about 15% of Canadians do not have a personal doctor. That amounts to almost 6 million Canadians that don't have access to a primary caregiver. So the next step, since I couldn't access a doctor or other Canadians can't access a doctor, the next option is to go to a walk-in clinic. The trouble is nowadays walk-in clinics are so jam-packed that they are taking appointments. And you have to go online to book your appointment within the next 36 hours. And every time you go on, there's no appointments. And a lot of them too are now taking memberships. So you have to be, already a patient of the walk-in clinic, which, makes sense for a walk-in clinic. And since I'm not a patient of the walk-in clinics around here, I can't become a patient and I can't use the walk-in clinic. So what's my next option? Well, the next option is to use something called telehealth, or if you have an insurance program like I do, we actually have an online resource that we can use that's hooked up to our medical insurance. So I went on there and I put in my symptoms, put in what I thought the issue was, what I needed, basically ear infection, I need some amoxicillin to get it cleared up. Denied. You have to go into a doctor or have someone see it. Well, the situation is I can't. That's why I'm using the telehealth to try and get an online diagnosis. So after that, the option becomes going to see a nurse practitioner. You can get an appointment to see a nurse, however, they can't prescribe a prescription. So if it's something that needs a prescription, it doesn't help me anyway. So then the option I'm left with is going into the emergency room at the hospital, the place reserved for emergencies. And if you go in with something like an ear infection or even a small cut that needs stitches, you're going to be waiting there for 6 to 8 hours if you're lucky. You might get seen sooner, but it's rare. I had a circumstance when my grandson was younger. He fell and cut his head on the corner of the coffee table. We went in to get stitches for him, and it was about 7 hours wait to get stitches, and he was 5 at the time, and he still has the scar now in the middle of his forehead between his eyes because it took so long for them to see him and get stitches in. So going into a hospital for an ear infection, which I decided I would do anyway, well, after 3 hours, I have other stuff to do. I can't wait that long. Now, it might sound like I'm bad-mouthing Canadian healthcare. It is pretty good for some people. My buddy had to deal with a brain tumor, and they fixed him right up. And he didn't go bankrupt because of it, but now he has some ongoing issues of paying for drugs. So it costs him a lot after the fact. But, the medical operation didn't cost him anything, which is a really good thing. So what have I been doing now? to try and fix the ear infection that I can't get antibiotics for? Well, I started eating a bunch more blue cheese, which I figure, you know, blue cheese, penicillin, mold. I don't know if that actually works or not, but that's where it came from, right? And then I've been throwing some peroxide in my ear. That's kind of cool because it bubbles and it sounds weird and stuff. And then we picked up some antibiotic polysporin eye drops, which someone told me was really good for earaches, ear infections. Well, that was a ton of work just to get, because they hide that behind the counter as well. So we finally got that, and that's what I've been working on. So thanks, guys. If you had any issues yourself with any healthcare system, let me know down in the comments. Be sure to hit that like and subscribe as well, and we'll be talking to you soon. Love you guys.